this great school within District 88. Welcome this evening to what will be one in many of a series for parents and community members, what we are calling a seminar and a workshop series. Most importantly, a conversation. We're excited this evening to see this room full of the tremendous amount of resources available throughout our local area, in our communities, throughout our county and our state, working together hand in hand to be sure that our youth, our adults, everyone has the support necessary to be successful in this ride. This evening's planning began long ago. Some of you were here about a year and a half ago when we hosted an evening focused specifically on heroin addiction and the growing epidemic that we're seeing locally, statewide, and nationally. This evening is a continuation of that conversation focused on addictions overall, and most importantly, the impact not just on the addict, but also their family members and the community surrounding them. And most importantly, again, having the resources available here this evening to speak about the support that's available to individuals, to families, and to all of us. We're excited because we have a tremendous partnership, as evidenced by the folks that are in the room. I want to take a moment to introduce a few really key individuals to help make this evening happen, and also highlight some of the organizations that are present today here at a public high school that, partnering with local churches and community organizations is vital for our success. We know that we do not stand alone. The first I'd like to introduce and to thank is Illinois Representative Conroy. Thank you so very much. Deb has been a champion for this work and has certainly been an ever-present member on our committee, planning this evening and hosting her own event just a few weeks ago. Also, Pastor Steve Swanson, who's another individual from the beginning who has said, what can we do to spread this word and continue this conversation? From DuPage High School District 88, our Superintendent of Schools, Dr. Scott Helton. Who sat side by side with Darlene Rossetti, who's the Superintendent of Schools at DuPage County, as well as Dan Cronin, and worked to bring these messages back to the high school setting. So much so that it helped coordinate and plan an all-high school symposium here at Willowbrook High School a year and a half ago that had 21 of our local high schools throughout DuPage County present here, and led a student conversation and seminar and workshop on how to take their messages back to their schools and start to spread this word. I can continue throughout the room. You'll meet a lot of other individuals throughout the evening, and certainly for the resource tables that are outside. But wanted to just highlight some of those components that are present tonight, because again, as a public high school district, our partnership with our state legislators, with the local clergy, and all the tremendous resources that are available throughout this county, we can win this fight. And when we say fight, we know it's more of an ongoing journey. It's one that is a daily component in all of our lives. All of us, in one way or another, are impacted either directly or universally because of the youth that we serve and the communities that we live in. So we thank you for being here tonight for a very important conversation. A couple of logistics, just to overview how the evening will run. We have 3 different speakers that will have a variety of different topics that they will address. We're going to ask that you please hold your questions for each of them until the end. We're going to have a panel Q&A. That's why we gave you the yellow sheet. The yellow sheet allows you to jot a couple of notes that you'd like to ask each of the individual speakers. So then that way at the end of the evening we can ask them universally. We'll have individuals who will be available to collect these. As you go through the evening as well, if you want to start to think about other topics that we could or should be addressing, that's the back side of the sheet. It's blank purposely because we didn't want to have any prompts to guide you down the path. We simply want to allow you the opportunity to jot some notes for us and feedback on this evening. So these yellow sheets will stay with us this evening. So questions that you'd like to ask the presenters, please put those on the front. On the blank on the back side, suggestions for our next meeting. On your table are also the blue outline of who is speaking this evening. We'll introduce them in just a moment. But also at the very, very bottom, the save the date for February 18, 2016. We'll be right back here in this room, or ideally, we will realize that we need a larger room. That's our goal, is to continue to spread this word. It is fantastic to see this room full. When we planned it, we said the best thing we could hear is that room was too small. because that means that there are more people coming to this dialogue and this conversation, and we'll continue to spread the word. So thank you so much in advance for your participation tonight. I want to introduce the three individuals who will be speaking with you this evening, and then in addition we have a video that's embedded in the component. The first is Tom Stamas. He is from the College of DuPage. We'll give just a moment to let him speak, and then Chris Miller will be speaking in terms of his own personal story, and then Mr. Nick Gore from the DuPage County Health Department, also a very good and close friend of District 88 and all of the community because of his work with us in the past. I'd like to welcome all three of them this evening to begin here tonight. Thanks.
Well, again, my name is Tom Stamas, and I am a licensed professional counselor. I'm also a certified addictions counselor as well. I work at a private practice called the Adult Children's Center, and it's located in Lombard. We provide individual, couple, family counseling. We also do substance abuse treatment as well as DUI services. So we do have comprehensive treatment program there. I'm also an adjunct instructor over at the College of DuPage, teaching primarily addiction counseling courses. My experience working in the addictions field is that I have been working about 20 years in the addictions counseling field, primarily working at an agency called House Counseling Services, which is also represented here tonight as well. Another wonderful thing about me is I'm also a former Willowbrook Warrior alumni, and I'm really excited to be here. To be able to come and present is very special and meaningful. So for me to come here and talk about something that I've been in the field for a long time with, I'm just very honored, to be quite honest with you. So as far as what are the different relationships people have with substances, because actually people do. There are some people that when they use substances, they may not have any problems at all. However, then there are some individuals that do experience negative consequences, and as a result, end up having an addiction. So, let me ask you this. Why do people use substances in the first place?
To make them feel better.
Okay, to make them feel better. Absolutely, right? Because maybe they have some sort of anxiety, depression, trauma in their life. Maybe they have pain, and so they're taking some sort of pain relief medication. Okay. What else? Yes? To fit in, right, actually to want to cope or to be accepted into a group. It's fun. It's fun, absolutely. They realize when you start having substances that maybe it's a good time for them, and they realize, or they associate it with a fun experience.
Stress.
What's that? Stress, absolutely. It helps them deal with stress. They realize, you know what, I come home, I have a hard day at work, they have a couple drinks, and that helps them relieve with stress. So we recognize that there are some, what they would say, benefits, right? If it wasn't benefiting a person in any way, they wouldn't do it again. So they're getting some sort of reward by doing or taking some sort of substance, right? I mean, that's kind of the reason why. Now, there's other people that will use substances in order to, because they're just curious, or because other people are doing it as well, whether it be family members or other friends. They recognize that other people do it, so maybe I'm doing it as well. So, when a person first starts using a substance, you have to admit there is a voluntary decision to use, right? I mean, no one took a gun to their head and said, use right now. They basically make a decision to want to use. However, for certain individuals, that voluntary use of substances becomes a compulsion to use, an automatic response. They feel the craving, they feel the urge to have to use. And the reason why that happens is because of the changes that occur within the brain. Okay? The brain, two parts of the brain that is really impacted due to substance use is what we call the cortex and the limbic system. Now the cortex part of the brain is your front part of the brain right here. It controls your decision-making abilities. It tells you that, you have to go to work in the morning, that you have to go to school, that you have to be responsible, that you have to make good choices and have good judgment. The other part of the brain, called the limbic system, that part of the brain, if you were to take one finger here, put the other there, where they intersect, that's where that is. And basically what that is, it's the pleasure center of the brain. So anytime you're having a fun experience, that gets activated. So if you go out and have a wonderful meal, or you go to the movies and you watch a funny one, or you go to a comedy club, or you're just having fun with friends, that part of the brain gets activated. It gets activated because it has these certain chemicals, feel-good chemicals, called dopamine, that gets released. Well, when a person ends up using substances, whether it be alcohol, cannabis, heroin, a lot of dopamine gets released, and so a person experiences a lot of euphoria. And that's the feeling that they love. That's what drives them. That's the feeling that they want to have, is this euphoria. And so what happens is after the person starts to experience a lot of consequences from their use, they recognize, you know what, this is really bothering me a lot. And I don't know if I can continue on like this anymore. There's a part of them that wants to use because, A, they're getting this really good positive experience, but then there's a part of them that doesn't want to use because of all the consequences, and their life has changed dramatically as a result. And so we see that many times over. So when we think of individuals who might be at risk for something like this, we look at, because sometimes people, not everyone who uses substances gets addicted. So who are the people that would more likely get addicted? Those research has found that there are certain components or certain risk factors that might be associated with drug use or addiction. One is your predisposition for it. They say about 40 to 60% of those that do become addicted have some sort of predisposition to substance use. So it runs in their families. Another risk factor is when a person ends up growing up in a home environment where there's a lot of substance abuse going on or a lot of trauma going on. So we see that as well. The other risk factor is early onset. So when a person starts using early on in their life, they end up using as a result of coping with maybe a situation. But a lot of times when they go into the treatment program, we look at what their first use was, and it's usually early on in their teens. Some of the other risk factors are that they may behave aggressively or be involved in the criminal justice system. So those are the certain things that they would recognize as risk factors. So what are some pro-social factors, protective factors, things that might be really good for people to avoid addiction? Well, that might be, that could be growing up in a home environment that's very positive, where communication is open with their parents. They also don't experiment with drug use at all. That's another thing that is a protective factor. They could avoid or delay using alcohol or other drugs. Actually having really good grades is another, doing well academically is another protective factor as well. But despite these risks or protective factors, there's really nothing that is one single factor that's going to determine whether or not someone is going to have an addiction. It's just not. There's nothing, one single factor that's going to do that. And even with the risk factors that I shared, I've come across students or young adults who have grown up in families where everything was going great and that their lives were wonderful. But unfortunately, they started using a substance for whatever reason. And as a result of that, they got addicted to it. So the one thing that I want to continue to pass the message on is that when a person does become addicted to substances, that there's hope. There's miracles out there. That treatment does work. It's wonderful to have resources in the community where people can actually go and get help and go to support groups. So I think that is where I want to see continued effort in regards to seeing people get better. So I really just want to say again, thank you for the opportunity to be able to speak tonight, and look forward to answering any questions that you have later on. Thank you.
Thanks, Tom. We had asked Tom to be here to sort of set the stage and provide an overview of conversation for this evening. Part of that conversation is a video. I'd like to ask Deb Conroy if you'd like to say a few words and also introduce the video as we start to prompt it for
For inviting me tonight. This has become something incredibly important to me, and I've spent a lot of time on the issues of addiction. As most of you have heard, heroin's been a big issue in DuPage County, so that's been a big focus of what we've done. I've learned a lot of really important things along the way, and I think one of the things that we've learned is that addictive personalities, I don't think many understand what an addictive personality is, and I think that's why tonight's event is so powerfully important. Because as our kids are growing up, they don't necessarily understand that a choice that they make where it could potentially lead. One of the most powerful things I heard said by someone who was a recovering heroin addict, and this was just recently, was parents are always worried about the bad kids or the demons in the dark alleys. Almost every addict that you talk to will tell you the first time that they did drugs, that they tried something, it was from a friend. It was a cousin. It was someone's brother. It's everywhere. We can't get away from that. That's why we have to talk about it. It's so important that we talk about it. It's so important that we empower our kids to understand what an addictive personality is. And that's why tonight is so important. And before we show the video, I want to just show these to you guys, especially you kids, okay? What this says is that understanding addiction is power. And we're going to challenge everybody to put their own picture on Facebook and put these out there to everybody that you know. Because it's important that we understand that. This video that we're going to show you tonight is so important. And before we show the video, I want to tell you a little bit about the people behind it. First, we have Lisa Snipes from Serenity House, who has become a very important person in my life. I met her just at a meeting and through a conversation, and it was kind of my beginning journey to understanding how important this conversation really is. And together we brought people together to create this video, and one of the most important people that gave of their time and their passion and their talent was Al, who's back here on the camera. He's always behind the scenes. He's always there to help people. So between Al and Lisa, myself, and a very small part as part of the team, 13 recovering heroin addicts were interviewed. They told their stories. And what we did was they were asked by Al, what would you do differently if you had known? This photograph, which I think you can see really, really well here tonight, is so powerful to me. This was a photograph that Al found online. It's from a Russian photographer, and only by the grace of God did he get in touch with this photographer and was given the permission to use this photograph. To me, this photograph shows an adolescent child. Could be a boy, could be a girl. We don't know. It's a lake. It's foggy. He's on the end of the pier. What's he going to choose to do next? It's his choice what he does. What does he choose to do? What do you choose to do? Your choice is the most powerful thing you have. I'd like to watch this.
Before I used opiates, I was about 14, 15 years old, and I was a very athletic kid. I loved to play sports. I always laughed. I was full of love and joy, and life was good.
Before I used heroin, I was in my second semester of college, and I came home from that because I was pretty depressed. I, at that time, was using alcohol and marijuana because those were socially acceptable.
Before I used heroin, I was 17 years old. I was using what I could find and get my hands on.
Before I used heroin, I was generally a fun-loving guy, much loved by all my family and friends.
Before I used heroin, I was very happy. Because I started using heroin, my life has changed by
the people that I started hanging around with.
Heroin cost me my family relationships, my children, my career, my home, my car.
What does heroin cost in my life? Everything that matters.
What does heroin cost? It has cost me jobs. I lost jobs because of using.
If I knew then that heroin would not only steal my soul, but also make me so physically sick that I was in so much pain and couldn't even function, to try and even imagine my world without it, it would have definitely taken me more time to give that a second thought before I picked it up. If I knew then how far down I would have gone, I never would have used heroin.
If I knew then that going to prison, going to jail, going to rehab, being homeless, losing family, just losing everything, I would have never picked up heroin.
If I knew then that I wouldn't be able to get a good paying job or get my own car or get my own apartment, take out a loan, or if I knew that I was going to jail numerous times, I would never have picked up heroin.
If I knew then where using heroin would lead me, I never would have picked up anything. Right now I can't imagine a life with drugs, but at that time I couldn't imagine a life without drugs. So if I knew then everything that using heroin would cost me, I wouldn't have ever picked up. I wouldn't have ever tried it.
As we had said about this evening, we knew that an opportunity to talk about addictions was going to be important. I'd like to ask Steve Swanson now to introduce Chris Miller.
This past week, Pope Francis was here, and one of the quotes he said is, "In particular, I would like to call attention to those family members who are the most vulnerable, the young. For many of them, a future filled with countless possibilities beckons, yet so many others seem disoriented and aimless, trapped in a homeless maze of violence, abuse, and despair. Their problems are our problems. We cannot avoid them. We need to face them together, to talk about them, and to seek effective solutions rather than getting bogged down in discussions." An outstanding faculty, the man named as outstanding faculty at College of DuPage, is with us tonight to help us answer some of those questions on what can we do. I present to you my good friend, Chris Miller.
March 17th of 2014, I was about 5 to 7 seconds away from being run over by a freight train. Let me back up a little bit so I can explain to you what happened. So, just to get it out there right now, everybody, my name is Chris and I'm a real alcoholic. When I was 15 years old, I grew up in Fort Collins, Colorado, where Colorado State University is located. When I was 15, I got invited to go to a party at CSU. And a friend of mine, we went to the party that night. And when I walked in the door, I was handed a pitcher of beer. I had never had alcohol before. I proceeded at that point to drink the entire pitcher of beer, and then go upstairs and puke off of the balcony. And came back downstairs and said I needed more. Should have probably known then I was an alcoholic, but
15, you just want to hang out with the cool college kid. Anyway, I drove home that night with my friend Randy. He was too drunk to drive, and I was only 15. He was 16, but I knew how to drive at that point, so I drove home. And I snuck in my downstairs window, and my mom, she used to always help me fold my papers for my paper route. And I remember she woke me up and she said, the papers are out front, and your friend is passed out in the front lawn. You might want to wake him up and take care of the papers by yourself. So I went outside and I got my papers with just the worst hangover I've ever experienced in my life. I told Randy he needed to get up and send him home. And I was pretty hungover all day, but that night was Sadie Hawkins' dance. And the girl who picked me up, she happened to have wine coolers. And I heard this phrase, like, hair on a dog or something. And so I had a couple of wine coolers, and guess what? My hangover went away. And I realized at that point, well, that's a good way to take care of it. Well, anyway, so I was captain of our football team since I was a sophomore. I was a starting quarterback. I was a free safety for Rocky Mountain High School. I was recruited by University of Alabama, and I signed a letter of intent my senior year to play ball at Alabama. But on November 4th of that year, one of my best friends, Scotty Rager, right before our state playoff game, he took his own life. And then in January, I went skiing at Copper Mountain, and I ran into a tree. And it exploded my right collarbone and punctured my right lung. And it took me 3.5 hours to get down that hill, but I have a snowmobile to bring me down. And I lost my money. I had no idea what I was going to do, you know. So at that point, I decided to drink all day. And I just got up in the morning, and I went to class, and I drank in the morning, and I went to Blockbuster Video. That was my sweet job back then. And I drank all day long. But, you know, I was able to control it, right? I mean, I was able to stop drinking for a year and take a couple times off from here and there, and I just did that. It's just what people did. And not to give you the entire story, but I ended up getting recruited by Northern Illinois University to join their speech and debate team. I was actually pretty good at that. So I came out to NIU, and I brought my girlfriend with me, my wife now. And it was just college life. I drank every now and then, but not every single day. I seemed to have it under control. Went to graduate school with my master's degree. And I started teaching at Kishwaukee College. And when I started teaching out there, I realized I didn't have any friends. You know, as you get older, you don't have friends. I mean, I was homecoming king. I was Mr. Popularity in high school, and I had a lot of friends when I was in college. But now all of a sudden, I don't have anybody. I have my wife, but Johanna she's a pretty popular actress in Chicago, and she's out every single night. Tuesday through Sunday, she's gone. And I'm just by myself. So I started doing things like I started training for marathons, and I started working out, I started going to church, and taking care of myself, but I was drinking every day. Not completely blackout every day, but just drinking every day. And then I moved to Lombard, and I just started drinking more. Man, I'm listening to Tom talk, and I'm like, it's hard to listen to someone like him talk, because, you know, they're talking about me, you know? Am I predisposed to alcoholism? I guess. I mean, or is it because my social environment made that happen? And I love football. I love it. I love the game. I love all sports. But every time a commercial comes on, it's led by Budweiser, and it's ended by Beefeater. Every time. You know, everywhere you go, every dinner party I go to, people have wine. People have alcohol there. And I just would go there and just have a couple, right? And do that. And then I'd get home, and for whatever reason, I just had this thing in my brain that was like, I just needed more. It just continued like that. It was just more. You know, since I got sober, 18 months ago, I just picked up my 18-month point on November 20th. I look back and I wonder, it's it's just so interesting. You know, I look back on what it was like, you know, and it was lonely. I was isolated, and I wanted to blame everybody. I wanted to blame my wife for being gone. I wanted to blame school for not recognizing me for the outstanding job that I was doing. I wanted to blame things, but I didn't want to stop drinking, and everyone else would drink, and I would want to drink with them, but I just couldn't stop. I mean, I lost some stuff too, you know, like, I wasn't going to tell you any of this, but I have 2 kids. You know, I have a 7-year-old son named Wyatt he's amazing, and I have a 2-year-old daughter named Margaret. When I first tried to get sober, I was getting sober and I was lying about getting sober, and I was hiding alcohol in ceilings and drinking a lot. My daughter was born on January 1st of 2013. And that night, I thought my wife told me she was going to labor New Year's Eve. And I thought she was faking it. And I went into the hospital and left that night. It's like, I'm going to go get Taco Bell. And I'm going to go get some Taco Bell. And 8 hours later, I waved down a cop and I said I needed help. And I needed to get somewhere because I was pretty drunk. And he talked to me for a little bit. He said, "Where are you at?" And I said, my wife said, at Alexia Brothers. And I'm supposed to go see her. And he said, "Okay, let me go verify that she's there." And he said, "Yeah, she's there." And congratulations, you had a girl. You know, I had 2 kids. And I wasn't there for one of them because I had to go get some body. This is like the real deal, you know. How my wife didn't leave me is only a miracle. How that little girl every day climbs in my arms and just calls me Dad is a miracle. You know, every day you're going to hear stuff about alcoholism. You'll hear stuff about addiction. People keep asking me things like, what's the answer? You know, if I had the answer, I certainly wouldn't be up here. I certainly would have seen magazines. It'd be boring. But I'll never do that. The only way this happens for me, I'm not allowed to talk about it, but I'm part of that secret society. There's people in the room, and I know that they're there, and they'll call me on it. They'll pull me outside later and give me a fine or something. But it's one day at a time. That's all that it is. One day at a time. I get up in the morning at 5:30, go to my kitchen, get a sip of coffee, and I fall on my knees and I pray. I don't know if you believe in God or you believe in a higher power. I don't care what you believe in. I gotta pray. I gotta fall on my knees and I gotta ask, whatever God that I believe in, just don't let me drink today. And it's not easy. I mean, it's easier. It's easier. But it's sometimes pretty hard. You know, yesterday my wife burned her hand on a grill, the next door neighbor, and she's like, I need some ice. And he said, well, here's a cold beer. You know, I was at home. And she's like, that feels better. He goes, well, open it, you know, it might make you feel better. And she's like, yeah, my wife's she's not a drinker, but she's like, okay. And she brought it back home, and I could see her carrying this beer coming to the house. And she walks me, she's like, I want you to know I have a beer. And Wyatt said, Dad, don't drink the beer. And I said, buddy, I won't drink the beer. He's like, don't, you know. But I go to a meeting and I opened my fridge to get one of my SodaStream bottles out, and there it was on the first shelf. And I mean, I had that moment of like, I would destroy that beer. But I realized I just can't drink because I don't want to have a beer. I don't want to sit down socially with you and have you talk to me about how great this wine is from Napa. I want to get hammered. I want to drink 11 bottles of wine. I'm not a regular drinker. And it took me a really long time to admit that. A really long time. Even today, sometimes I'm like, I know I'm not really an alcoholic, but I have all these problems. Nah. That's when I need to call somebody and be like, listen, I just told myself this. And they're like, yeah, you should probably come to a meeting. Look, it's just, this disease is no joke. You know, and I work with kids at COD. Over the last 18 months, it's been interesting going one day at a time and try to get help and having to move out of my house and live at a halfway house for a month and work on my wife and my relationship with her. But over that past year, I've done 5 plays. I was voted outstanding faculty member at college in DuPage, and how is that even possible? And now I'm in a doctorate program at Northern Illinois. In 5 years, you're going to call me doctor. But I'm not going to get any of that if I drink a beer. One drink, just one. I think about sometimes taking Mags, hoping that she one day gets married. How am I going to walk down the aisle with her, give her out to somebody else, and then not drink? Isn't that comical? I'm thinking about something that's going to happen 23 years from now. How am I going to do that? I need to worry about just driving home. I need to worry about getting in my car, calling my wife, putting on a podcast, listening to it, and driving home. That's it. Now, if I do that, guess what? Then I'll be one more day to 19 months. That's all it is. Can't think ahead like that anymore. I can't think ahead. At COD, I have a lot of students that come up to me and they ask me about, my alcoholism has not been anonymous. It's been pretty public affair. And I have students that come talk to me about it. And I've lost 3 students at this point that have come ask me for help and they seem to get help and then all of a sudden they're not in my class anymore. Unfortunately, all those are because of heroin. But if you have people that and I know there's some kids in front of me, and I'm trying to figure out sometimes, like, what do I need to do to help people get sober? And people keep telling me that's not your job. You need to keep yourself sober. I want to help other people, and you can't help other people. You got to make sure you stay sober, and then do stuff like this that I don't overly like doing this. I was driving over today and I was like, man, like Pastor Swanson, he's a buddy of mine, I'm going to do it for him. It's hard going into a room feeling like you're less than. And then I doubt in my mind, I feel like I'm less than everyone in this room. Still walk through the hallways at COD, being an outstanding faculty member, and I still feel like I'm just a low drunk. And what's weird about it is that I walked into the school today, and these kids were outside, and I walked in, and this one kid goes, "Hey, nice jacket." I got made fun of by a teenager. What you realize is that I could still beat him up, but I can't imagine what it must be like to be in high school again. I mean, I'm 42 years old. I'm in the best shape of my entire life right now. Now, I've lost 60 pounds in a year because I just don't drink anymore. I mean, my resting heart rate is like a 43. It's stupid. I'm getting made fun of by a teenager. Can't imagine what they do to each other. This, you know, I was talking to Principal Dan, I'm trying to remember your last name, but I was talking to Dan before the thing, and I thought to myself, like, how did they do it? You know, I mean, watching, I teach at West Chicago right now, and I teach 1100 classes, and these students, I observe them as a comms person, I observe them high-fiving each other, and making fun of each other, and kissing and holding hands, and I think, man, I miss those days, but I would never want to go back. I mean, I get made fun of because I'm wearing a jacket. It's pretty expensive. These kids are experimenting with drugs and alcohol and things like that, and they want it. Let's say they want to quit. You don't think I wanted to quit? I wanted to quit every day for years. I don't see my friends I used to see at church. I don't see them because I'm too embarrassed to see them. I don't see Pastor Swanson as much as Mark because I'm embarrassed. We're beautiful. But I'm an adult. I don't worry about getting zits anymore. And if I get one, who cares? It's kind of cool to pop in a mirror. But these kids themselves go through the hallway and their entire life is basically getting made fun of. And if they find one thing that makes them cool and their friends want to hang out with them, like using drugs or alcohol or anything like that, they just try it, and then they want to quit, and then they have no one else to talk to about that. They have no one to go to. They're going to get made fun of. Their friends that they just made, and now all of a sudden they want to stop using drugs, and now they're going to have to, and they tell us, you got to change your people, your places, and all that stuff. You're going to leave your friends? That's not going to happen. And we say, can you go talk to your parents? Come on, look, I'm talking to a bunch of people that are as old as I am. You telling me right now you forgot what it was like to be in high school? You didn't. And if you did, go back. Volunteer at a high school, and you remember what it was like. It's not easy. It's hard. It's hard to grow up. It's hard to work with college kids that are scared. And we're scared for them. We helicopter them. We take care of them. We do their homework. They call me to ask what their grades are. It's hard. And we don't make it easy on them. And we just say, community, you have to talk to each other. You don't even offer a speech class, a communication class in K through 12. We don't even offer it. We offer speech classes in high school, but they teach each other how to make guacamole. You're not teaching them listening skills. I know this because I assessed them in college. And they don't know what they're doing when they come to me. So I have to teach them an organizational pattern that's basic. I have to teach them stuff like active listening and how to organize messages in college. And they should know that in 2nd grade. And now we want them in high school to go talk to their mom and their dad who's telling them to clean their room? It doesn't work. God forbid talking about possibly that you're doing heroin. You guys, there's no answer to this. The answer is let's pray that they don't kill themselves while they're doing it. That's the answer. Hope that they find a higher power. Hope that they find someone like me or some of my friends around this room so we can talk to them. I'm the only person that can talk to another alcoholic. I truly believe that. My wife used to tell me, you got to quit drinking. My answer to you, F you. That was my answer. I'll drink more now. But as soon as another alcoholic told me to stop drinking, I went, why? And he said, this is why. And I went, I'll listen to you. This isn't a simple answer. You can't go home today and say, we got to talk. It'd be great if you go home and say, we got to talk about stuff. But the real answer is you got to get that person to come talk to me. I'll tell them how hard it is. And I'll tell them some answers. And they got to stay sober? I don't know. They might not. I can't help them like that. I got to worry about getting my ass back to Lombard without drinking. Because I got to take care of 2 kids and a wife. That's what I got to worry about. You want to help out? You want to help this whole thing work? Keep coming to these things and inviting just someone with you. Not an alcoholic, not a drug addict. Just invite someone. Create awareness. Start teaching human communication in the kindergarten level and push that through. I don't need right now my kid, I don't need Wyatt to learn the difference between excited and exciting. I don't need him to know that yet. I need him to know how to listen for tone. I need him to go, I have a friend that has a problem, I have to be comfortable with talking to an adult about this. He can make that decision. He knows when I'm mad at him because he'll say, Dad, are you mad at me? No, why? Because you have your mad face on. He can read nonverbal communication, but he doesn't know when he's supposed to use excited or exciting right now. Well, I'll work on that later. It'll happen for him. I wish I could come up here and give you an answer. The only thing I can give you right now is my hope. My name is Chris, and I'm an alcoholic, and I'm okay with that. I feel like I'm less than other people, but I know I'm not. And in time, with God's help, I will get better. I'll stop introducing myself and telling everyone I'm a drunk. I'll stop remembering all the time. I'll stop, like I remember when I first got sober, I used to drive by liquor stores and go, just keep going, keep going. My plan was, my tool was, I used to pull into, when I first got sober, I'd pull into a liquor store, and then I'd go, okay, identify 3 frozen yogurt places you could go to right now. That's what I did. Like, okay, Skinny Sweets in Glen Ellen, that'd be good. Rainbow Cows in Bella Park, a good one there. And that just got me past it. It got me past that little moment there where I didn't have to go into a liquor store and buy another pint of Schmear. That was my plan, right? Today I drive home and I don't even see liquor stores. I'll pass mine, I know I will, but I don't stop for them. I just won't. And I have a better chance today because I do a couple things every day. I pray, go to meetings, and I call my sponsor. That's what I do every day. It's not going to work for everyone, but it's what I do. I'm really grateful, I'm really happy, and I'm just really grateful I'm an alcoholic today. I never would have had the things that I had unless I didn't go through these experiences. My daughter and I have a great relationship. My son and I have a great relationship. My wife and I have the most amazing relationship. We've been dating since I was 19 and she was 17. It's better today than never had before. Because I had to go through that. I just thank God I didn't die in the meantime. And I'm really, really glad that day I was face to face with that train. After I said amen, some crazy voice said move. I didn't question it at that time too, by the way. I'm out on that. But I'm real glad I'm here. I'm glad I'm here and I can share this message with you because it's going to help me stay sober. So you may applaud for me or thank me, but I thank you for letting me share this message with you because you kept me sober today. And that's all that I care about. Thank you.
Thanks, Chris. I will say that the young man outside was probably complimenting your jacket because of his there's a lot of compliments that fly around at Willowbrook High School. I'm sure it was. Thank you very, very much for being here tonight. Our last speaker is Nick Gore, and Nick and I go way back, and I say way back about 2 years now. Together. So that's way back in the work that we do in schools, because in 2 years you can truly have a significant impact. And I've had an opportunity to see Nick in a lot of different capacities in working with our students, in working with the high school symposium that we hosted here, and an evening that we hosted at St. Paul Lutheran Church, and now very pleased and excited that he's working with the DuPage County Health Department and being able to support the work there at the county level. So I'd like to introduce Nick Gore.
First of all, thank you for having me back here. I think this is the 4th time I've been in the community, and I hope to be back again. My name is Nick Gore, and I'm a heroin addict. So, Chris, Chris, everything that you said, man, I could totally relate to. I walk in here feeling less than, you know, I feel like people give me the googly eyes, and there's that heroin addict, but as of 2 days ago, I celebrated 36 months of clean time. To that anonymous thing that we can't talk about and taking it one day at a time, and you know, sometimes even an hour at a time or 20 minutes at a time, and breaking, you know, my day down, even, you know, being clean, you know, 36 months, you know, sometimes, you know, life gets a little rough, and I'm going to die a heroin addict, but there's one of two ways that I'm going to go as a heroin addict. I'm going to go as a sober heroin addict, or I'm going to go as a heroin addict that overdosed and died. You know, and I do the things that Chris does, you know, to ensure that I go the way that that I prefer to go, as opposed to, well, you all know what the other one is. Some of you have heard my story. I'm not going to delve too far into that. I'm here to talk more on what the county is doing in regards to the heroin epidemic, because it truly is an epidemic. I personally, since I've gotten sober, have lost 16 friends to a heroin overdose. Now, these aren't people that are just people that I met in passing. These are the friends that I have attended meetings with, people that I've lived with in halfway houses, people that I, you know, had to go and hug their mother and tell them I'm sorry that, you know, for the loss of their child. So this is a real thing. It's a real epidemic, and unfortunately, it's growing at a very rapid pace. If you would have told me that I'd be talking as a representative of the DuPage County Health Department even 6 months ago, I would have probably told you that you're full of it. I'm a two-time convicted felon. I lost things, had things repossessed, have done horrible, horrible things to people. But what I did is I went back and I made amends to every single person that I hurt. I am in the process of financially making amends to all of those things, because that's what I need to do to maintain my sobriety and continue on my recovery. So enough about me. In 2013, let me read you some statistics here real quick. In 2012, there were 38 deaths due to heroin or opiate overdoses. So either heroin or pills, any heroin and opiate-based pills, Oxycontin, Vicodin, Norco, same thing. There was 38 opiate/heroin related deaths. In 2013, there was 46. And in 2014, there were 33 deaths in DuPage County. So in 2013, my good friend Rich Jorgensen, who was the coroner, I never thought I'd be friends with the coroner, especially as a heroin addict. Let me tell you, walking in vertically to the coroner's office as a heroin addict is like the most gratifying feeling, because most get rolled in. We kind of all threw our hands up when we did community forums kind of like this, and I told my complete story, and we went and spoke to about, honestly, probably about 100,000 kids. I was able to go on Oprah, on the news, this, that, and the other, just to get the message out there on what this epidemic is doing. Well, DuPage County, I'm proud to say and privileged to say that I'm a part of it now, is a leader in taking initiative and setting the tone on how to combat this epidemic. In 2013, they rolled out the DuPage Narcan program, that every first responder, officers as well as ambulance or paramedics, are all outfitted with 2 doses of Narcan or naloxone, which is an anti-reversal drug that will help pull someone out of an overdose. Now, granted, the stars really kind of have to align for someone to be saved by that. You have to have someone, A, who's going to call. It has to be quick. You can't have someone, you know, sitting there for 30 minutes not breathing, hit them with this drug, and then have them come back. But they really took the initiative, and there's, I'm not going to mention which town it is, every single town in DuPage County is, every officer carries 2 doses of Narcan with them. Since they've initiated that, 72 lives have been saved.
Wow.
So that was, I guess you could say, phase 1 on how to combat this disease. Get all the first responders, most police officers arrive on the scene first. So they went through extensive training. The DuPage County Health Department shelled out a lot of money so that all the officers in DuPage, all first responders, I should say, are equipped with naloxone or Narcan, and they've been able to save 72 lives. They've given 72 people a chance at recovery, something that Chris and I get to share today. That, you know, if they didn't have these, didn't have this, they would no longer be here. So after it was a long, they had to kind of see the results first, and we're kind of now into the second phase of where we're at with Narcan. I'm going to just continue to call it Narcan, naloxone, it's the same thing. So we're in the second phase, I guess, of what Narcan is. When someone gets saved by Narcan, they get sent to the emergency room. If they're clinically stable, they're usually released within 2 to 6 hours. So in that 2 to 6 hours, the drug throws you into immediate withdrawal. It makes you extremely combative, usually most of the time. And the first thing that you want to do when you leave the hospital is go and get high again. I mean, well, what else do you know to do? Someone snags your beer away from you, what are you going to do? You're going to go find another beer. So that's where I come in. I was contracted by the DuPage County Health Department. I wish I would have worn my fancy little badge to prove that I actually do work there. But they came up with this project, this pilot program called Project Connect, and I'm just going to read it directly from here on what it is. Project Connect is a program that was designed to provide and support linkage for individuals who have received life-saving Narcan through the Illinois Department of Substance Abuse, DASA, and the DuPage County Narcan Program. The DuPage Narcan Program is a collaborative program that began in 2013, and their core mission is to save lives by ensuring that law enforcement have the training and equipment to provide administration of Narcan, a non-addictive drug that can reverse the potentially fatal opioid overdose. The overall goal of Project Connect is to ensure that participants and their families receive the support that they need to end addiction and engage in a successful lifetime of recovery. So my role today is to go out and establish with the 6 hospitals in DuPage County working relationships with them. So when someone comes in from an overdose, we can be first responders in a sense to provide them options. We've set up with numerous treatment facilities, IOP, PHP. It's a 24/7 job. I'm on call 24/7. Unfortunately, it's not launched yet. Obviously, there's a lot of work that has to go into it to establish these relationships and to help these people understand what we're trying to do. But I'm happy to say that we're a month ahead of schedule. We're supposed to roll this out November 1st, and October 1st is when we will be seeing patients and helping them, or clients, whatever you want to call them, get the recovery and help that they need. So I'm extremely excited about that there was a lot of work that went behind the scenes. So, you know, for someone who is in recovery support, family support, friend support, the thing we can't talk about support, that's vital. But what we're there for is to, you know, find out what their initial assessment needs are, both physical and behavioral. Unfortunately, if you overdose, you're in there for 2 to 6 hours, and then you're right back out on the streets, which is absolutely ridiculous. absolutely ridiculous. You need to be hospitalized, you need to be evaluated, you need to, the list can go on and on and on. So we have that little short window of time to get in there. So unless you have a huge abscess on your arm and you're not clinically stable, then you get admitted. So what my job is to do as a peer specialist, because I can obviously relate to a heroin addict, along with another girl that works with me on this project, she works from a clinical standpoint, to help facilitate what their needs are. Do they need to go to a halfway house? Do they need to go to detox? Do they need to go to IOP? And help establish that, and also work with their families, their support system, whatever that is, whether it's a girlfriend, a boyfriend, mom, dad, brother, sister, cousin, aunt, whoever, help them understand, give them the resources that they need, help send them to, Al-Anon or Nar-Anon, something like that, so that they can help recover themselves, because they've been dragged along most likely in their addiction as well. We're there to not just, intervene with them for the first, get them into treatment, but to have a working relationship with them. Again, we have not had any clients or patients yet. To be quite honest, as a heroin addict, in that 2 to 6 hour window, it's going to be quite tough to get someone to sign that release of information, because you're thrown into withdrawal. You're thrown into a situation that you don't want to be in. You just were virtually pretty much dead, and now you're saved. So that's where I can come in and offer that hope and that that hope that recovery can be had. Like Chris said, I'm grateful that I'm a heroin addict. I truly am. It's made me. If there's one thing that I could change in my addiction, is the innocent bystanders that I infected. But everything that I went through has led me to this point, and I'm extremely grateful to be a heroin addict, a recovering heroin addict. Let me make sure I'm not missing anything here. Yeah, so again, since 2013, I think this number just jumps off the page at me. Since 2013, 72 lives have been saved. 72 people have had a chance, to recover from this seemingly hopeless disease, where you don't feel like you're the scum on the bottom of someone's shoe, or have a crappy jacket on or something. You gotta laugh about it, right? So, does everyone know what Narcan is real quick? You want me to go over that real quick? Sure. All right, so naloxone is a non-addictive prescription medication that, if used while someone is having a heroin or overdose, can save a person's life. It is more commonly referred to as Narcan. It is an agonist, so it blocks the opiate from brain receptors, allowing the person to breathe again. It essentially brings a person back to life. It can reverse a potentially fatal overdose in some cases. However, it only acts on opioids. If the individual is having an overdose or another drug overdose or no drug overdose at all, it has no effect on the individual. So if I were just to jam Narcan in my arm right now, there'd be no ill effect. So if you came home and you have a recovering drug addict and your kid is just out snoring because they actually went to work and did the things that they're supposed to do, and you hit them with Narcan real quick, you're not gonna with that. So again, our job is to, you've just been saved with Narcan. Now what? Here are your options. We're going to be in there presenting, what options are available, hopefully getting that release of information from them so that we can work with their family members, because the only way that I've been able to stay sober is with a lot of support. Not only through things you can't talk about, but through family support and friends that I, like Chris said, I isolated. I isolated because I didn't want to share my heroin, to be quite honest. So that to get everyone involved and not make it so secretive in a sense. So to get hopefully someone is there that we can help with their recovery. Chris did a great job on, knowing what your triggers are. I know my triggers are, me as a heroin addict waking up each morning, that's a trigger. Taking that first breath of air, that when in my using, that was a trigger. But helping them, these individuals identify that they have a disease, that they're not the scum of the earth, that they don't have to walk with their head down through the hallways, and they're not less than. For a long time, I felt less than. Today I can proudly stand here in front of you and say that I am a heroin addict. It's a part of my past. It's helped me become who I am today. I'm not proud of it. I'm grateful for it. So I think that covers everything that I have. Again, it's through DASA, through the Department of Alcohol and Substance Abuse. It's who is funding my grant to do this. It runs, I started on July 15th, happens to be my birthday. Just if anyone wants some present next year. So we started on July 15th and it runs through June 30th of next year. So hopefully we can, save lives in this process. And, maybe not, I can't say save lives, help people, help guide them in the right direction so that they can save their own lives. I can't make Chris stay sober. Chris can't make me stay sober. But, alone I can, together we can. And that, I think that's extremely vital. And we're not there just going to be a one and done. Hopefully when people are in residential treatment, they sign a release of information and we can continue to follow up with them for, up to 6 months and track their progress and help their needs along the way. Helping them find a job, their social skills and all that they may have not developed because they started using drugs when they were 13 years old and have not been able to develop that. Help find what they need to move on in life and become a productive member of society like Chris and I are today. So I thank you for your time. I'm grateful again to be here, just like Chris. And Dan, thank you so much for allowing me to come back. And Scott Helton's still here to dip out. Well, thanks, Scott, wherever you are.